Welcome back. When you feel sick, you know it's time to go to the doctor. But let's say you're struggling with depression or behavioral health issues. When do you know the time is right to get help? Monte Vista Hospital provides a safe environment to do just that.
Joining us now from Monte Vista Hospital, we welcome physician Jason Chang and medical director Faisal Suba. Welcome, guys.
Thank you guys so much for this opportunity. We really appreciate being here.
Yeah, you bet. We're happy to have both of you guys on the show today. Faisal, we're going to start with the doctor. Is that okay?
Oh, sure.
Yeah, I know, because I know you're gearing to get in there. Dr. Chang, let's talk about what the biggest challenge it is that you face when you're dealing with geriatric care.
So in geriatric psychiatry, you're going to see everything you see in general psychiatry, with the exception of dementia-related behavioral issues. That's kind of the unique aspect of geriatric psychiatry. Now, the biggest challenge in managing patients that are in the geriatric population is the fact that we have to recognize that, they're not just older adults, right? I mean, as we age, our organs also age, right? Your kidney is slowing down, your heart is slowing down. You have to take all of those into consideration and basically manage their symptoms with those things in mind, which means that a lot of times you have to go slower, you have to go easy. And in modern day, I think medicine, people expect that things will go quick. Like you have a headache, you take a Motrin, the headache goes away, right? Now, unfortunately, in geriatric psychiatry, you really need to build a strong relationship with the patient to make them understand that, we can help you, but it's going to take time.
Okay.
You just can't expect,
Okay.
And I'm going to just add on that a little bit. I think one of the most important things, apart from the patient relationship, is the relationship with the family.
Yeah.
The family, I mean, just getting them to understand what their loved one's going through, what the progression of illness is, especially like if you're dealing with dementia or Alzheimer's or something of that nature. It's very difficult for the family and loved ones to care for the patient, understand the illness.
Yeah.
Do you know what are some of those health issues that you do see in the older generation, geriatrics?
So we see a lot of depression. Anxiety disorder is also very common, just like in the general population. Those are very common things. Chemical dependence is not uncommon as well. So,
That kind of just to help with pain. Is that why you see that, or?
Well, it's more of addiction in general, and a lot of times, many of them probably start off as having pain, and then eventually became an addiction. And so it's how do you treat their addiction while, managing their pain at the same time. That's difficult.
I think it's interesting because, you're hitting on kind of an assumption as we think, addiction has to, affects kind of younger, middle-aged people. But in fact, why would it not affect the older population as well?
Right. Yeah.
And when you see that too, when you have things like addiction or other issues, what kind of services can you guys provide at Monte Vista Hospital to help with that?
So at Monte Vista Hospital, we pride ourselves in offering just about every level of psychiatric care, from intensive outpatient treatment, intensive inpatient treatment. We have a partial hospitalization program. We have an intensive substance abuse addiction program. We have community liaisons that actually go out into the community, mobile assessors, to help people get to us so that we can help them. It's a 202-bed hospital. We've been around, I think we're one of the oldest hospitals in the Valley that offers psychiatric care, So,
It is unique what you do because you're specifically gearing your care towards the older population. And it makes sense to me that you would, specialize in that area because, like you mentioned, there are special qualities often when you're dealing with the psychiatry of an older adult, right?
Yeah, that's correct.
And when you get into the background a little bit too, and I think we mentioned off camera that you two were trained together, so you guys can you can know each other to help each other out too.
Yeah.
It actually works. It works out awesome because when we did our residency training together, our treatment modalities are similar. It works well. Our whole group at Monte Vista actually is amazing. We're happy to help the community in any way we can.
Well, guys, we appreciate you guys coming in this morning. We have the information on your screen for your website and phone number. And where are you guys at?
The address,
location? Yeah.
5900 West Rochelle Avenue. You can see us on the web, www.montevistahospital.com. Our phone number is 702-364-1111.
All right, good to have you both.
Thank you.
Thank you guys.
so much.
Thank you so much.
Monte Vista Hospital, you heard them, located on Rochelle Avenue, just south of Flamingo near Jones. Their phone number, website right there on your screen. They're a proud sponsor of Las Vegas Morning Blend.